thank you very much for joining us today for supporting GP practices with inclusive, effective patient communications. So just a little bit of housekeeping. First, please be aware that we're going to be recording this session today, and your videos and your microphones have just been turned off while we go through the presentation. If you do have any questions, please pop them in the chat and we'll go over them in the Q&A section at the end. Also, if you haven't registered for this session directly, so if you've joined through a link that was shared by somebody else, please make sure that we've got your email address, your job title and organisation in the chat so we can make sure you're invited to the D&T network and you can get access to the recording and all the other information afterwards. So my name is Claire Temple and I'm joined today by Serena Schofield and Shelley Hawkins from Docmail, and also a locum practice manager, Tracy Dell, who'll be sharing her experiences with you a little bit later. So this is the agenda for today. We're looking at why patient communication matters, and it matters more than ever at the moment. We're going to have a little bit of a look into vaccinations and the patient understanding and some examples that we've done in the past few weeks. Also talking about digital exclusion and patient choice, and noting that we have that reasonable adjustment flags that needs to be in and up and running by September. And looking at some practical ways to improve communication. And then we're going to have a short demo by Docmail, who are going to explain their product and what that's all about. And then we'll have some questions and answers at the end if you have any. So first of all, good communication. It matters in general practice because it directly impacts patient outcomes. So when communication is clear and timely, we see improvements in key areas such as on the screen, like vaccination uptake, screening attendance, QOF performance, appointment management, and we also see a reduction in DNAs. And put simply, when patients understand what they need to do, they're much more likely to take action. But the opposite is also true. So poor communication can quickly lead to missed care. Patients may not attend appointments. They might miss important checks or not respond to invitations. And it also causes confusion. So if messages aren't clear or consistent, patients don't know what to do, which can delay care. And this leads to more admin work. Practices spending more time handling repeat calls, rebooking appointments, and clarifying messages. So this isn't just about patient experience, it has a direct impact on workload, efficiency, and overall outcomes across the practice. So this is a really good example of where communication makes a real difference in practice. So we've recently been working with a PCN on a 6-week campaign to improve childhood vaccination and immunisation uptake through patient education. And what we found is that this isn't always an access issue. Often it's about understanding, trust, and awareness. So once we segmented patients into different cohorts, we tailored communications, making sure that messages were delivered in a way that patients would understand and be able to act on. And through this work, we identified the remaining children who'd not been booked in. And these were patients who were unresponsive to standard messaging. Some had levels of hesitancy or had other barriers like language or digital literacy. And the key point in this is that practices told us that they didn't expect these patients to book in. This was a final push before the end of the QOF year and expectations were low. You can see this challenge was described by one of the practice managers as a positive win regardless of the timescales, as we managed to help them complete 73 vaccinations across the 4 practices in that 6-week period. So that was great for patient communications and education. And this is how we focused our approach for improving that patient knowledge and understanding. So practices were supported with a range of targeted communication tools, including tailored messages and supporting visuals. We focused on simple explanations, using plain language to explain why vaccination matters and clear instructions as to what patients need to do next. We also used short, engaging formats like the AI avatar videos. So there's 2 screenshots of the AI avatar videos there. The left-hand side one is in Turkish. That helps reach patients who might not read longer messages or need information explained in a different way. And it supported the messaging that was going out on social media posts, which were really well received. And the analytics there show the impact that they had in the first week of the campaign. But importantly, everything was targeted to different patient groups, recognizing that patients have different concerns, levels of understandings, and those barriers. So this is moving away from that one size fits all approach and instead makes communication more relevant, consistent, and easier to act on. But communication is only effective if patients receive it. So many practices rely heavily on channels like SMS, the NHS app, and digital messaging, but not every patient uses these and not every message is seen. And this means, is anybody else not able to hear me? Seeing the chat message pop up. Serena, can you hear me?
I can hear you, yeah.
Okay. Maybe try logging off and coming back on, Madeline. Yeah, so we can't assume that sending a message equals sending communication. And this is where your wider channels like your website, your social media, and your waiting room screens become really important. They give you multiple opportunities to reach patients in different ways, increasing the chances that your message is actually received. And once patients do receive that information, then you can use it to guide them to the right place to book or ask questions. But not everybody uses digital formats like these. So if communication is only effective when patients actually receive it, the next step is making sure we're using the right channel for the right patient. So not all patients engage in the same way, and not all messages are suited to the same channel. So for example, text messages and NHS app notifications are great for quick, direct prompts like reminders or simple calls to action. Your website and your online consultation platforms are used for more detailed information and guiding patients through what to do next. Social media can help raise awareness and reach patients who might not engage through traditional practice channels. And then those email and community routes can support more targeted or group-based communications. And most importantly, we shouldn't forget telephone and paper letters, especially for patients who are less digitally engaged. No single channel will reach everyone, so this is about using a mix of channels in a planned way to make sure your message has the best chance of being received and acted on. So even in a digital first world, paper communication still has an important place in general practice. Physical letters remain highly trusted. They have very high open rates and they're often preferred by older patients or those that are less digitally engaged. But that said, it's important to strike the right balance. So there is a cost associated with physical mail. So practices should consider whether a patient can be contacted effectively through another channel first. But for those who can't, or where digital hasn't worked in the past, letters are still a reliable and effective option. So physical mail isn't a step backwards. It's an important part of an inclusive communication strategy, helping make sure that every patient can access the information and care that they need. Physical mail often, again, feels more personal and considered. People recognise that time and effort has gone into sending it, which can increase trust and engagement. And this Royal Mail market research gives a great overview of why mail is still trusted. It creates less pressure. Unlike texts or online messages, there's no expectation for an immediate response. So it gives people time to properly read and absorb the information. There's also a strong perception of security and credibility. So many people associate physical mail with official or trusted organisations, making them more likely to believe and act on the information. Another point is that the idea of physical proof, having something tangible in your hands, makes the message feel more real and memorable, and people are more likely to keep it and refer back to it later. Also, physical communication is also seen as more informative, with space to provide fuller detail compared to short digital messages. The tangible nature, again, being able to touch and hold something can increase the attention and even response rates as it stands out more than digital noise. And then finally, there's an emotional element. So many people simply enjoy receiving mail, which makes it more likely that they're going to engage with it. So alongside this and the letters, we need to recognise the reality of digital inclusion in general practice. So there are three key areas to think about. So the first is digital skills. So not everybody feels confident using smartphones, apps, or online services. And while this is important, it's not always the biggest barrier on its own. Secondly, connectivity. So some patients simply don't have reliable access to the internet, data, or devices, and without that, digital services aren't an option. And then thirdly is accessibility. So services need to work for everyone, including patients who rely on assistive technology or who have additional needs. There are many patients who may struggle with digital access. These might be older patients, patients with disabilities or learning disabilities, patients with language barriers, and also those with socio-economic challenges. So while we're moving towards more digital ways of working, we have to be mindful that not everybody can engage in that way. Digital first must still include non-digital patients. And this links back to what we talked about, using the right channels, making sure that communication is received and making sure that no patients are left behind. So I love this slide. This slide brings the wider picture to life. So this is an infographic that's produced each year by the Good Things Foundation, and it highlights the scale of digital inclusion across the UK. So you might not be able to see all of the bits on it right now, but when you get the slides afterwards, you can have a better look. The positive news is that things are improving. So the number of people lacking basic digital skills has reduced over the last couple of years from around 10 million in 2023 to around 8 million last year. So progress is happening, but this is still a significant number of people. And when we look across general practice, many of these patients will be the same groups that we've talked about. But what this also shows is that digital inclusion isn't just about access, it's also about that confidence. So if we can build confidence with both staff and patients, particularly by using trusted and recognised tools like the NHS app, we can help people realise that they already have many of the skills that they need. There's a lot of existing support available in communities through places like libraries, community centres and charities, and that can help patients to build those digital skills. And there's an opportunity here to link practice communication with community support, helping more patients become confident and able to engage digitally over time, while still supporting those who can't. So supporting those digitally excluded patients is an important part of delivering inclusive access under the new contract. So while there is a strong push towards digital routes, it's important to remember that these sit alongside, not instead of, traditional access. So patients must still be able to contact the practice in a way that works for them and receive appropriate care. And a big part of this is understanding your population. So involving digitally excluded patients in shaping your approach can help identify real barriers and trust and build trust in how services are delivered. Practices should also make the most of local partnerships and practice events to share information and support patients who may be struggling. Things like flu clinics, or if you have any days that you invite cohorts of patients into the practice as a group, they're great to give support to patients. And following on from supporting those digitally excluded patients, the reasonable adjustment flag is another tool to help practices deliver inclusive access. So it's a national NHS service that allows practices to identify and record when a patient needs additional support for accessing care. So for example, they may have a disability, a long-term condition, or a communication need. But once that's recorded, the adjustment is coded in the clinical system and it's shared via the NHS spine, meaning it's visible to other healthcare services. And this helps ensure patients receive consistent and appropriate support across the system. Importantly, there's now a national expectation for this to be in place. Practices are expected to be routinely identifying and recording reasonable adjustments with full implementation required by September this year. And in practice, this means planning adjustments in advance. So whether that's longer appointments, alternative communication methods, accessible environments, or support with digital access. And this links again to everything we've discussed around access. By identifying the needs early, practices can guide patients to the right route and reduce barriers rather than reacting at the point of contact. So the reasonable adjustment flag helps ensure that we move towards digital and structured access and that services do remain inclusive. So good communication doesn't require big changes. It's about getting the basics right. So however you send a message, make sure it's clear and simple with call to action instructions, using the right mix of channels to help ensure patients understand what to do and are more likely to act. Support patients who may be digitally excluded, including using tools like that reasonable adjustment flag to tailor communication appropriately. Small improvements like this can lead to better understanding, increased uptake of services, and fewer missed appointments. So with that in mind, we're now going to move on to an overview from Docmail, who provide a scalable and effective letter communication service to help practices reach patients who may not engage digitally. So over to you, Serena.
Thanks, Claire. Just bear with me when my slide just picks up. Apologies, my laptop's not moving on to the next slide. Can you see that correctly now? Fantastic.
Yes, we can.
Okay, so thanks, Claire. So Docmail is our hybrid mailing solution here at CFH. It was originally launched back in 2008, and one of the very first account sign-ups was actually at a GP practice. Since then, we've seen over 75% of GP practices using Docmail, and since then they've sent over 100 million letters through the system. Now we have practices sending single letters, we have them sending bulk mailings, and the types of communications that they're sending can range from single appointment letters. We have practices sending ERS referral forms. We have them using them for bulk communications, so vaccination campaigns for flu invites, COVID invites. They're used for screening programs or for general practice updates. So for example, if you had a large mailing to send out to notify households of a change across the practice, be that a GP retiring or you're merging with another site, you could use Docmail for sending out those bulk communications. So it can be used for anything that physically needs to go into the post. It's a very simple process. The generating the documents will remain exactly the same. So practices will generate the letters as they currently do in-house. The only difference is when they're getting to the printing stage, they'll select Docmail as the printer rather than sending to the desktop printer. So I'm going to provide a demo for you now to show you the process of actually sending the communications through the Docmail print driver. So as I said, the letters themselves, they will be generated in exactly the same way as they currently are. Can you see that letter that I brought up on the screen here?
No.
No, Serena, we can't. We can just see the 17th slide.
With me. Can you see the letter now?
Yes.
Yes, we can.
Perfect. So as I said, the letter will be generated in exactly the same way. So if it's a single letter, you're going to the patient records, you'll select the template that you need to send, you hit file and print. If it's a mail merge that you're wanting to send from the clinical software, you'll go directly to the search and you hit merge and print. The only difference then is when you're getting to the printing stage, instead of sending those letters to the desktop printer, you'll have Docmail as a printer option. So you select Docmail as the printer. Now at this point, it will ask you to input your login details for Docmail. You can tick remember me and you're not putting them in on a daily basis. So as part of our onboarding process, we will provide the necessary training for staff to ensure that they're confident in using Docmail. We will show you how to set up what we call a profile. So once you've selected Docmail as the printer, it will automatically open this window here. You're simply going to come across to this profile list and you're going to select how those letters need to go. So as part of the profile, you will select options for black and white colour, single-sided, double-sided print, how you want it posted to Royal Mail, so whether it needs to go standard delivery or first class, if you want your return address printing on the outer envelope, and if it needs any additional documents enclosing with it. So rather than having to go through those options every time you're sending a mail in, you will save those settings as a profile. So you're simply going to select the profile, how the letters need to go, and then you're going to go straight to view proof. Now, had this been a mail merge of, say, 100 letters, if you just wanted to confirm it was going to the correct recipients before you checked your proof, you can come up to this top toolbar here and you can click on the address list. And what that will do is it will show you all the recipients within the mail merge, so you can confirm it is going out to the correct patients. Once you've done that, you're going to click view proof and it will generate a proof for you to check. You're just then going to simply click on the document, you're going to open up the envelope and it will show you what your letter looks like here. So you do have the ability to zoom in to the document closer if you need to. If it's multiple pages, you'll use the arrows to check every page. So once you've checked the proof is correct, you're just going to click OK and approve and submit, and off it goes to be printed and posted by Docmail. So it really is as simple as that. 4 clicks and those letters are with Royal Mail the following day. What you'll also have access to, so that is when you're printing direct from your clinical software and using the print driver. What you also have access to on the Docmail website is you've got a dashboard here called My Mailings. So at any point, if you want to check the status of a mailing that you've put through Docmail, you can log on to your web account and you can check the status of it. You've also got an admin section here. So you can generate reports on the account. So for budget purposes, if you need to see how much money you'd saved since you started using Docmail or how many letters have been sent out every month, you're able to generate your own quite detailed reports within the system and it pulls the data from your account. What you've also got access to on the web portal is, as we said, if you've got a particular requirement for a bulk mailing, for example, a notification across the practice or your flu invites, and you don't want to put that through your clinical software and your print driver, you can actually send that via the web portal. And how that works is you will run off a list of all the patients in the clinical software that need to get a copy of that letter. We'll then ask you to export those names and addresses into an CSV or an Excel file. You'll then type up the letter that you're wanting to send, and you simply just log on to your account. You upload your template, you upload your data, you select how you want us to print it, and we will mail merge that for you. So as I said, that's predominantly used for practices when they've got a particularly large bulk requirement, and we do the mail merge and the print and post at the same time for you. So that's basically a very short demo to show you how simple the process of using Docmail is. As I said, if you're using the print driver, it is just a case of file and print to Docmail, and we will take care of the rest. If it's a particular bulk requirement, you can upload your data and template, and we will do the mail merge for you. So we've included a case study from one of our existing practices in West Yorkshire here. Docmail has been used across Bingley Medical Practice in West Yorkshire for the past 8 years. They have sent over 7,000 orders through the system and sent over 11,000 letters. They are a good example of a practice that sends both single and bulk letters. So they've been sending appointment letters. They're set up sending their ERS referral forms, and they send bulk mail merges direct through System 1. So they have taken advantage of the additional functionalities within their print driver. They use the OCR extractions for the ERS referrals. They use our mail merge functionality because they're sending bulk through System 1. So they send the majority of their letters that need to go out will be put through Docmail.
And I just add to that as well. It's the same if it's EMIS that you're using as well, not just exclusive to System 1.
Thank you. So I'm going to hand over to Tracy Dell now. Tracy is our locum practice manager. She's been in practice management for many years now, and she's going to share with you her experience on this.
Thanks, Serena. Yeah, that kind of scares me when I think about this, because when you just said 2008 with Docmail, I think we were probably one of your very early customers. I started in general practice in 2003, and I remember when this came along, it was like, wow, you know, we're kind of revolutionizing the way we do things. And of course, we did a lot more via post in those days than we do now. But that's not to say that that isn't just as valuable now as it was all those years ago. So as a locum practice manager, I was in one practice in West Yorkshire, not the same practice with the case study, but actually I live very close to the Bingley practice. But quite a few practices in West Yorkshire that I've worked in and in other surrounding areas. So I was in practice in West Yorkshire for about 18 years in one practice. And we've built a very close relationship with Docmail when we introduced it, and we maximised the use of all the functions, and it gave me a really good opportunity to do that. But working in different practices has kind of highlighted to me that we all do the same things, but we all do things differently. And that's a real barrier sometimes with adopting new technology or adopting new ways of working. I think the main thing for me around Docmail is the fact that it saves so much time. Now, it doesn't matter so much about, you know, the time when you start looking at costings, but when you start to cost how long things take, and even just, for example, Docmail versus an envelope and traditional post, for example, you've got to think about all the other things and all the other processes that are involved. Who buys the stamps? You know, you're printing, you're folding, you're putting it in. Someone's got to take that somewhere, whether it's dare I say, to a franking post box, because I still come across practices that are using franking machines, and I do despair at that, and I will be a bit outspoken about that. But as a locum manager, I go to practices that are using franking machines, and it's just not cost effective for them. They're in lengthy contracts, it's costing them a lot of money, and then there's the whole hoo-ha about who takes it in the bag to the post box. It's got to be a special one for frank post. So I think the main thing for me is about making those reasonable adjustments for our patients. We have to remember that whilst we might be able to get someone down the fast lane of that motorway with all the technology and all the ways of, you know, doing things, whether it's text message, whether it's by, you know, putting things on our website, whether it's communicating with them in different ways electronically, we've also got to remember that some patients, and that's not just those that are kind of unable to access or are digitally excluded, you know, unable to access all this IT functionality, but there is a choice element as well. We've got to remember that. And I think it's really important, you know, certainly for CQC and anybody else that's assessing the delivery and the quality of care that we deliver to our patients, they will be expecting us to be taking into account their choice. We don't just do things in general practice because we have to and because we are mandated to do things. We do things like this because it's the right thing to do. So I think giving patients a choice, but doing that efficiently and effectively for our patients by utilising software like Docmail is really important. I think the main thing for me, just to sum up really, is around security and safety. We're always really worried. It always feels really safe, doesn't it, to put an envelope, put a letter in an envelope and stick a stamp on it and post it, because we feel that that's safe because we're in total control of what goes on. CFH are an approved NHS supplier and provider. And you can check this out on their website. It's one of the first things that we checked before we engaged with Docmail and with any other provider. And it's something that's really important to us. And it also gives us assurance for our patients as well. So as part of the 10-year plan and as part of the new contract, we have to do things differently. We are mandated to work differently. We are mandated to try different pieces of software and engage in this process. But we need to do that safely. We need to know that it's going to be better than what we're doing already. And we need to make sure that that's an efficient way of doing things, as well as providing excellent care to our patients and giving them choice. So that just sums up my experience. I've had a really, really great experience with Docmail and all the team. I've not had any resistance from staff in engaging in processes. It takes a little bit of time to set your print driver up, but it's a minute amount of time, considering how much time we're wasting by using, kind of paper post or Frankie machines or whatever else we're doing. I think it's just a really good way of doing things. It's super efficient, but it's also really effective for our patients. And it's also very cost effective as well, because I've done the cost effective, exercise as well. So that would be my slant on it. It's really about, kind of doing the right thing because we want to do the right thing, not just because we have to.
Thank you, Tracy. And that's a good point there. We get asked all the time, how long does Docmail take to implement? I basically say to practices, you can start using Docmail as soon as you need to. There's no contracts that need to be signed into. You can set an account up and start using it as soon as you need to. Usually, the thing that we're waiting on is the IT to install the print drivers. So once that's been done, we react quickly in providing training sessions for you, and you can be using it as soon as you need to. So just to highlight the importance of the right communications to you, and the power of printed communications and letters in the post. So we have seen it's increased patient engagement and understanding. A letter allows you to put more content in it. It gives a clear understanding to the patient of what it is that you're writing to them about. And as a result of that, we have seen reduction in DNAs. So I would say a letter's a great way of reminding a patient of an appointment. You can stick it on the fridge in the old-fashioned way, or you can actually take it with you to the appointment. So it is great for that purpose. Docmail is allowing practices to streamline the processes. So it's giving you that functionality to be able to print and post wherever you're working. If you have staff that are still working remotely, they are able to print and post those patient letters when working from home and also in the practice as well. So you're not having to get up and go to the printer and then put things into an envelope and take them to the post office at the end of every day. It is a trusted, reliable source of information. So when that letter is dropping through the letterbox and you're opening that envelope, you know that letter has come from the practice. It's on practice letterhead. It is a trusted source when you're receiving those communications. And how is this achieved? So as we said, it's a clear and concise messaging, and it's delivered on time. It is giving you the ability to engage with all your patients, physical and digital communications for a full 360 approach. We are able to provide documents in accessible formats. So if you did have patients that needed to receive letters with large font size, if you needed printing onto yellow paper, even if it needs printing on Braille, we are able to take that as an additional requirement and provide the letters in those formats. So you are ensuring that you're engaging with those patients that need that. And as we've said, it's a practical solution for all the teams. We provide all the necessary training to ensure that your teams are confident in using Docmail. So we can tailor that training to specific requirements. For example, if your secretaries were only sending ERS referrals and they need to be shown how to do that specifically, we will tailor the training that's delivered to ensure that they're confident in doing that. And as Tracy mentioned, it's about working with a partner that you can rely on. At CFH, we've got all the certifications you would expect from a high secure print and mail organisation. We have exceeded expectations in the IG Healthcare Toolkit, so you can ensure that your data is kept secure. So what we're offering today, so for joining this webinar, we are offering all our clients a discount code of 10% off mailings through Docmail. So what I would say is go on, set an account up, just to highlight you're not signing into contracts to do that. There is no setup costs involved. You also don't pay us any monthly subscriptions. It is a pay-as-you-use service, so you can set an account up and you can trial using Docmail by sending one mailing out through there using our discount code. As I've said, we will provide all the necessary training. So if you would like to arrange a more in-depth demo with myself offline, then just let us know and I can organise that for you. If you want to set the account up and you're happy to start using it and you'd like to organise some training with our trainer, then again, just let us know. We do also have a support team as well through Docmail. So any day-to-day queries, if you have, there's always an office-based team to speak to. So we do support you from the setup to the onboarding and then ongoing support moving forward by using Docmail. Thank you. So is there any questions that we need to go through?
I think we have a question there from Tracy. Is it cheaper to use Docmail rather than franking machines? I think as Tracy touched on when she spoke, yes, it will be. It's not just comparing the postage costs, it's also comparing the efficiencies that you're improving. You know, you're not buying as much envelope, you're not buying as much paper. People's time is the biggest saving overall. So yes, I can say that we can sit here and say, actually, when you look at the whole process, it is more cost effective to use Docmail.
And I think you've got to take into account, if you look at the overall costs as well, depending on how you are sending your letters out, if you are using a franking machine, if you actually look at what you're paying for that franking machine, you'll be paying a line rental for it. You're then paying the postage cost on top of that. I was talking to a practice last week that said they had to replace the toner cartridge and it was £200 just for that alone. And then obviously you've still got your stationery costs. So you've got your paper, your envelopes, your toners for your printer. And as Shelley's mentioned, also the admin time on top of that. So if you take into account the overall cost, then yes, you will find it is cheaper.
You're also in a contract as well with the franking machine, and usually they're very lengthy contracts. I've managed to get out of so many franking machine contracts for practices. But you are paying maintenance, supplies, not just for your postage cost, it's all the supplies as well, you know. So I think overall, unless, you know, and most practices are not really using the franking machine like the big corporate companies use them, you know, with kind of thousands and thousands of letters. So I think there's an issue about scale as well for practices.
Yeah, I mean, we touched on this the other day, Tracy, didn't we, with the volume of letters. I don't think you could justify the line rentals you pay with a franking machine now, whereas with Docmail, because you're only paying pence per letter and there's no additional line rentals, it fits in well for the amount of letters that you are sending. You're only ever going to pay for the volume of letters that you need to send.
Yeah.
Thanks very much. I've opened up mics and cameras if anybody wants to come on and ask a question. I've got a nice comment for you from Susan, who's left. We've also been using Docmail for a number of years and can recommend. That's nice from Susan. So all of the resources and the information from this webinar, including the recording and the slides and the discount code and all the information you need to contact Docmail, will be in the D&T network. You can join the network by scanning the QR code on the screen, but afterwards you'll also be sent an invite to join anyway. It's free, you don't have to pay. It's a network of about 1,400 people working in primary care across different roles. So we'll pop all of that information in there for you. And as always, we would be eternally grateful if you could fill out our feedback form for today's session. If you fill it in, you will go into the draw for April to win a £25 Amazon gift voucher. So it is well worth a go. I'm just going to pop the link in the chat as well. There we go. So you could either download the QR code or you can use that link in the chat. But all that leaves me to do is say thank you very much for joining today. Thank you very much to Serena and to Shelley and to Tracy. Thank you, and I hope you enjoy the rest of your day.